And good morning, everyone. My name is Imran Kazmi, and today I am going to present my topic analyzing the strengths and limitation of assertive communication in health and social care. I am studying the certificate of higher education in health and social care at the University of Suffolk, London campus, which is delivered through the London School of Commerce. Student ID S33779. Thank you for giving me the opportunity to present my work. In this presentation, I will explain what assertive communication is, why is it important in health and social care, its strengths and limitations, how it supports person-centered care, how healthcare professional can improve it, and finally, I will conclude with the key points. What is communication? Communication is the process of exchange information, ideas, emotions, and experience through verbal and non-verbal method. Effective. Why is communication important? Effective communication improves patient safety and care, build trust and therapeutic relationships, supports person-centered care, reduce misunderstanding and mistake, facilitate collaboration in working space. Aim of the presentation to analyze the strengths and limitation of assertive communication, examine application in health and social care. Uh, Understanding assertive communication is expressing thought, needs and opinions clearly, respectfully and confidently while organizing and respecting the rights of others, he said. Arnold and Borg 2019. Verbal communication, clear language, respectful tone of voice, active listening, appropriate questioning, non-verbal communication, eye contact, open posture, calm facial expression, appropriate gestures. For example, a nurse needs to explain a treatment plan clearly while allowing the questioning and express concerns. Improve patient safety, clear and direct communicate, reduce misunderstanding and help prevent errors, build trust and respect. Patients feel listened to and valued when professionals communicate confidently and respectfully. Encourage patients' participation. Patients are more likely to ask questions and become involved in their care. Support shared decision making. Clear information helps patients make informed choice about treatment options. Prompt professional confidence. Healthcare professionals can raise concern and uh, advocate effectively for patients. Healthcare: a nurse informs the doctor that a patient is allergic to penicillin. The medication is given, preventing a serious allergic reaction. Limitation of assertive communication: culture difference. Direct communication may be viewed as rude in some cultures. Emotional situation: distress. Patients or families may misunderstand the message. Requires communication skills. Not all healthcare professionals are confident communication communicators. Risk of being perceived as aggressive. Tone and body language can affect how messages are interpreted. Temperature: busy environments can reduce communication effectiveness. A nurse clearly, as an example, healthcare example I given, a nurse clearly explains to a patient's family that visiting hours ended due to hospital policy because the family is upset and stressed. They perceive the nurse's communication as insensitive, and become angry. Application Assertive communication is commonly used in explaining treatments and procedures to patients, reporting change in patient conditions, raising safeguarding concerns, managing conflicts professionally, supporting person-centered care planning. Healthcare professionals should adopt assertive communication by simplifying language for children and people with learning disabilities, using empathy during emotional situations, considering cultural belief and preferences, using visual aids and interpreters when necessary, adjusting nonverbal communication and tone of voice. Assertive communication supports person-centered care by empowering the reception of care, encourage patients to actively participate in decisions about their care, improving quality of life, ensure care is tailored to individual needs and preferences, supporting independence, help patients make informed choice and maintain control over their care, promoting positive well-being, builds trust and improves emotional and physiological psychological well-being, honoring choice, respects patient values, preferences, and treatment decisions, promoting respect ensures individuals are treated with dignity, empathy, and compassion. Uh, Improvement strategies: healthcare professionals can improve their assertive communication by developing active listening skills, giving full attention to patients or colleagues, avoiding interruption, and using positive body language such as eye contact and nodding, participating in communication training, attending workshops and role-play sessions to practice handling difficult communication situations effectively, improving emotional intelligence, understanding and managing their own emotions by recognizing and responding uh, appropriately to the emotion of others, seeking feedback from colleagues, receiving constructive feedback to identify strengths and areas of improvement in communication, reflecting on communication experience, reviving past interaction to understand what went well and what can be improved, practicing person-centered communication technology, focusing on the preferences and feelings of the patient while communicating in the empathy and respectful way. A situation where assertive communication is effective and challenging. Effective situations is emergency situations, safeguarding concerns, patient advocacy, team meetings, providing instruction and education. Challenging situations, end of life discussion, mental health crises, aggressive behavior, cross cultural communication, communication with children or people with learning disabilities. Reflection. Sorry. I have learned that assertive communication is an essential professional because it promotes patient safety, person-centered care, and collaboration. Conclusion: assertive communication improve patient safety by reducing misunderstandings, error, and miscommunication in healthcare settings. It helps in building strong therapeutic relationship by trust, respect, and open communication between patient health and healthcare professionals. It supports person-centered care planning by ensuring patient needs and concerns are included in care decisions. Enha- It enhances teamwork and collaboration by promoting clear, respectful, and effective communication among healthcare staff. It encourages shared decision-making, allowing patients to take an active their treatment and care plans. This at World Health Organization 2022. Thank you.